Hello everyone, myself Dr. Rajendra Punya. I am a faculty of radiology in Nextillo. Today we are going to discuss in the clinical crux of very potential important questions which you are going to face in your examination very frequently. So let's start the session. First, look at your screen. These type of questions are very commonly you are going to see in your examination. These are anatomy based examination, in which you are going to see coronal or axial section MRI, coronal, sagittal, or axial sections of the brain MRI, in which they are going to mark a part and going to ask you, name the structure. They are going to give you 4 options, and the one is going to be the answer. So let's see. I'm going to give you first few questions. Try to mark them correctly, and don't worry if you are not able to answer that. Don't worry. We are going to explain it everything, and we will come back again to the questions and we will answer it together. So first, look at the first question. One part is marked with the red arrow. Look for it and try to answer it. Okay? Enough time is given. Now, let's go to the second part. And sagittal section image is given and part is marked. Try to answer it. Okay? Now, let's move to the third image. Okay? Again, a sagittal image of brain MRI is provided and a part is marked. Try to answer the question. Don't worry, if you are not able to answer, we are going to discuss it. Okay? Now, an axial section brain MRI is provided. Then, try to answer the marked part. And the final question. Okay. Write it down. Now, let's first discuss what we are looking at. So, our first part is sagittal section of MRI brain. Now, we are going to discuss, let's see, what we are going to do. We are going to start from here. We are going to start from this part. Okay. So, what is this? This is spinal cord. Okay. This is spinal cord. This is medulla oblongata. Okay, this is medulla oblongata. This part is pons. Okay, what is this? This is cerebellum. Okay, can you see this part? This small part out here? Let me use the other color with it. Have a look to this small part. What is this? Sometime in examination, when they are going to mark this part, and what we see in hurry, okay, this is cerebellum, and the first option will be the cerebellum. So always look clearly. Look all the 4 options first, and then mark it. Okay. What is this? This is cerebellar tonsils. Okay. Now, let's move upward. What is this? This is pituitary gland. Okay, this is pituitary gland. This is important and frequently asked. Okay, now let's move to this part. This part. This is very important question. This is corpus. Yeah, I know you all know the answer. Corpus callosum. Okay, now, in the corpus callosum, they ask each and every part. They will mark it differently and they will ask each and every part differently. Okay. So if they mark this part is called gene. Okay. This part is body of corpus callosum. Okay. This part is body. This part is genu. And this part is splenium. Okay. Understood? Now, among these, this is kindly mark it as star. Splenium is frequently asked. Genu part is frequently asked. Pituitary is frequently asked. And cerebellar tonsils is also frequently asked. So, remember this, okay? Now, beyond that, have a look. If I do mark this area, what you will call this? This whole of this area. Okay, what is this? This is frontal lobe. frontal lobe. This part is, the red mark part is occipital lobe. Okay, and the last, this part is, I'm going to mark it with the green, this part is parietal lobe. Okay, these are the important things that we should know. Okay, so this part, genu, splenium, body, pons, medulla oblongata, spinal cord, ठीक है, frontal lobe, occipital lobe, parietal lobe, okay, and this part sometime if asked, actually thalamus is not seen, generally not marked or asked while in sagittal. That is actually asked in your axial sections. If asked in case, then marked is as a thalamus. Okay, these are the potential questions that you are going to face frequently in your exams. I think concepts are clear right now. Let's move on the axial image. This is a axial titulated image. Now look, this part which we had asked earlier, this is caudate. Okay, this is caudate. This is putamen. This part is putamen. Have a look. Okay, this part is putamen. This part is head of caudate lobe. Okay, now what is this? This is thalamus. This is thalamus. Both of these are thalamus. Now, medial to putamen is globus pallidus. Globus pallidus. Okay, and this part going in between is internal capsule. It's generally not asked. The important part is you should know head of caudate, globus pallidus, putamen, and thalamus. In this section, you should know this. What is this? And what is this? This is part of corpus callosum, what we have discussed earlier. Okay, this is splenium of corpus callosum. Okay, this part could be genu. This is splenium of corpus callosum. Okay, so this is the anatomy part which we have to discuss, and it will give you multiple questions. Now let's go to the question part. Now see how many of you could answer this. Now give me the answer of the first. This is pons. Okay, any doubt? This is pons. This is medulla oblongata. Okay, and this is part of midbrain. Now, next move to the second image. Are you able to answer? What is this? We have discussed medulla oblongata. Very good. Now, come to the third image. What I have told you, this is corpus callosum. But part of corpus callosum are particularly asked. So this part is, which part is anterior? Genu. Genu part is anterior. This is body of corpus callosum. And the last one, this one is splenium. Okay. Now let's move to the second. Let's move to the next question. What is this? I have told you recently, this is head of caudate nucleus. Caudate. Okay. This part is putamen. Okay, these are thalamus. And this is the last question which we have discussed. What is this? I think you all know question. This question you can all mark it rightly. This is thalamus. So we have completed an important part. Always go to your exam, just revise it. Okay, revise, because it is expected that at least you can get one question out of there. Okay, now what we are going to discuss next is hemorrhages.